Hello, and welcome to this week's edition of NHIS in a Week. Here, we give you happenings and insights of the authority and the scheme. For this week's edition, we are reporting live from the Central Expo 2025 at the Adisadel Park right here in Cape Coast. Now to our first story. The Chief Executive of the NHIA, Dr. Victor Wasari Bampo, continued his nationwide regional tours with visits to 4 more regions. His engagements in Ahafo, Western North, and Central strengthen staff morale and deepen stakeholder support for government's health agenda.
Dr. Bampo and his team began the week in the Ahafo region, where he addressed staff and stakeholders on government health priorities. He highlighted the 3 pillars of universal health coverage: the NHIS, Mahama Cares for non-communicable diseases, and the free primary health care policy. The CEO decried persistent illegal charges and fraudulent claims, warning facilities and staff to desist from practices that erode public trust.
We have a 3-point vision that we're trying to implement or help the authority to implement. The first one has to do with all of us, and it has to do with eliminating what we call co-payments, that which is not the right word, and also fraudulent claims. And that's where you come in. Not you as Goso Hospital, but the stakeholders that provide the service.
On staff welfare, he introduced initiatives such as credit union, vehicle acquisition scheme, and equitable training opportunities. Deputy CEO of HR and Administration, Mr. Raphael Sakbeb, assured staff that anomalies in promotions and welfare were being addressed.
Everywhere CEO goes, the things we hear about promotion. Yes, it's not something that we are sleeping. We're working on it, or we have everybody promoted. But we need to have things done properly, systematically, and in a way that nobody is left behind.
The delegation also paid courtesy calls on Member of Parliament Collins Dauda and the Gwaso Traditional Council, who pledged their support for the authority.
Moving on, global advisory firm KPMG met with NHIA leadership last week to explore collaboration. The talks focused on digitalization, fraud detection, and strategies to strengthen the National Health Insurance Scheme.
The KPMG team, led by Dr. Anna Van Pook, held discussions with NHI Deputy CEO of Operations, Dr. Senonu Jokoto, on how global healthcare expertise could support Ghana's insurance reforms. Dr. Jokoto highlighted Ghana's digitalization progress, including 100% electronic claim submission and mobile renewals. KPMG shared its global experience in AI-driven fraud detection and universal health reforms, expressing optimism about future collaboration.
To our next story, the chief of Seshi Boinzan, Nana Ofori Ahinkan II, commended the NHIA chief executive during the regional tour. He praised both the authority's reforms and President Mahama's bold health policies.
Dr. Bampo, leading a high-level delegation, visited the chief as part of his working tour of the Western North region. Nana Ofori Ahinkan lauded reforms, including the uncapping of the NHIL, decisive sanctions against fraudulent claims, and the establishment of a co-payment task force.
Hospital no ana the pabonifo bi ana mo hospital mo fa so edit as at this time it's about 300 and it's a 14,000 or so. I start to be, but at the end of the day Mama hospital, they will refund that. Now, say, you're not able to say, I can't be and never Yamana Botswana. It will never, and I'm on power to.
The chief pledged the traditional council's support and appealed for more resources for local NHI officers. Dr. Bampo reassured him of management's commitment to align reforms with government's flagship health programs.
From the Western North region, where the NHIA boss was hailed for his reforms, the authority moved into Cape Coast for the Central region's biggest business and investment fair, the Central Expo 2025.
NHI's presence at the fair included public education, digital renewal demonstrations, and direct engagement with exhibitors and visitors. The Central Regional Team and Corporate Affairs Directorate used the event to raise awareness of the scheme and address illegal charges. Management expressed confidence that the outreach will boost membership and strengthen public trust in the NHIS.
Our expectation at this year's expo was to make the NHIS brand very visible, that is branding our booths and attracting people to our stand, and they're getting the opportunity to educate them on what the NHIS is about. And so far, it has been good. Members who visited our booth were educated on how to renew their membership using the star 929 hash short code. We also introduced them to our app, which is my NHIS app, where they can register using the app at the convenience of their home.
Here at the Adisadel College Park, the NHIA used the expo as more than just an exhibition. It became a stage to showcase the scheme, reach thousands of Ghanaians face to face, and roll out new initiatives to drive universal health coverage. Now, let's take a look at how the authority made its presence felt at the expo.
Away from the exhibition booth, staff engage patrons face to face, explaining services and demonstrating the star 929 hash short code and my NHIS app. Many welcomed the initiative, describing it as timely and practical. Regional management said the drive formed part of efforts to build confidence in the scheme and expand membership across the region.
Central Expo is a very good opportunity for the National Health Insurance Authority Central Region to actually build a strong network with the exhibitors. We have issues about confidence that the public have in the NHIS, and we leverage on this avenue and we sensitize them that there are challenges with illegal charges. But then we built the confidence, telling them that, yes, it is the thing of the past, because now NHI is actually paying promptly. We don't owe any of the facilities unless you are not submitting consistently. And by that, a number of people who have been here since Monday have been engaged. And then we'll follow them up to wherever they come from, either their communities or corporations.
The NHIA in the Central region launched a new outreach drive called NHIS Evangelism Hour. The initiative was announced during the ongoing Central Expo in Cape Coast.
The initiative is designed to take the NHI's message directly into communities and institutions. Regional leadership explained that the exercise would be sustained beyond the expo through collaboration with district officers. The Evangelism Hour is expected to boost membership renewal and improve public awareness of the scheme's mandate.
What the NHI's Evangelism Hour seeks to do is that twice in a week, the whole employees of NHIs in the Central region go out there to make NHIs very visible, make the branding light, and then make it come very conspicuous to the society. We directly engage the public. We talk to them. We do instant renewals. We do instant new registration. We also distribute the NHI's handbooks, which will let the people be able to know the medicines that it covers. That is, to talk about the benefit package, the facilities that they can identify with regard to the credentialed ones. These are all the avenues that we use to make NHI very loud in the central region.
Moving on, the NHIA supported the Methodist Church of Ghana during its 190th anniversary celebration in Cape Coast. Over 100 members registered or renewed their health insurance during the event.
The Cape Coast District Office, supported by the Corporate Affairs Marketing Team, organized the outreach. The exercise formed part of the authority's community engagement effort to expand access and deepen awareness of the scheme. Officials expressed confidence that such initiatives will sustain membership growth as Ghana moves toward universal health coverage.
To our next story. Some NHIS members in Cape Coast have shared positive experiences, highlighting how the scheme continues to ease healthcare costs and improve access to medicines.
In separate testimonials, the students and entrepreneurs underscore the scheme's role in reducing financial pressure and encouraging regular health-seeking behavior. The testimonials reflect the scheme's relevance in easing the burden of healthcare expenses and reinforce the NHI's call for continuous membership renewal.
So I have the NHIS card and I advise you to get a card because it can cut your medical treatment costs. For example, if you have malaria, if you need dialysis and you have to pay a sum of 100 cedis, if you go to the hospital, you could get it for free or you could even get it as low as 30 cedis. So I like to urge everyone to get a card because it will help you when you go to the hospital, even when you don't have money. So we are in our hospital. So we won't grab you. We have problems with and it's as so why would you and I say we be that in your so be a health system.
Now to our last story. As part of activities of the Central Expo, NHIS engaged the public with an interactive "What Do You Know" quiz session.
The fun-filled activity tested participants' knowledge of the NHI's benefit package, digital renewal platforms, and the rights and responsibilities of members. Patrons who answered correctly received NHI's branded souvenirs, while staff used the platform to clarify misconceptions about the scheme. The What Do You Know session added a lively dimension to NHI's presence at the Expo, reinforcing its commitment to deepen public understanding and encourage active participation in the scheme.
Jimmy Ruffle, I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro Boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This brings us to the end of this week's edition of NHIS in a Week. For more stories, log on onto our website on www.nhis.gov.gh and do visit our social media platforms displayed on the screen. My name is Bridget Appiah. Thank you for watching.